Okay, so welcome everyone. Thanks for joining us tonight. So we're going to be talking about tinnitus. So I did include an about me slide, but Elizabeth covered a lot of this already. Basically, I'm a general ENT doctor. I treat all and every realm of adult and pediatric ENT. I am part of ENT and Allergy Associates, which is a large ENT group. We have multiple offices throughout the tri-state area. I'm in Paramus, New Jersey office. This is my background. One thing I would just add is that I am local. I grew up in Wyckoff, went to Ramapo High School. So I am now back in the area for the past 2 years working out of Paramus. So first question I often get on tinnitus is how to pronounce it. There's a lot of debate. There's two variations, which is tinnitus or tinnitus. In my opinion, either is acceptable. You can choose whichever you think sounds better. There's no right answer, in my opinion. So basically, what is it? Tinnitus is a very broad, vague word that covers a lot of symptoms and a lot of things. The definition of it is that it's the perception of sound without an actual external source of the sound. So vast majority of cases are totally subjective, meaning only the patient, the person experiencing it hears it. The doctor cannot hear it. No one else can hear it. There are some very rare causes of tinnitus that are objective, but vast majority, 99%, are only perceived by the person experiencing it. There's many descriptions. It can be perceived as in one or both ears. It can be perceived as coming more from the ears themselves or from the head in general, or sometimes even from outside of the head. There's a long list of different ways that can be experienced also. As far as the most common one is just sort of a high-pitched constant ringing, but other people experience more of a hissing or buzzing, humming, pulsing, clicking, roaring, many other descriptions as well. Any of these things and all of them would be called tinnitus. Non-specific and subjective. So what is the impact? This is something that is very common. It's quoted that affects anywhere from 10 to 20% of all adults, which estimates to 50 million Americans, which is a huge number. This is likely a large underestimate, as this kind of only captures people who have been bothered enough by their tinnitus to seek medical evaluation and care for it. There's likely many more people out there that have a milder version that they just deal with and never seek any sort of help with. So that it's likely even higher numbers than that. The incidence increases with age. This is likely because of the association with age-related hearing loss, which we'll get into later. And thankfully, most cases are very mild. People are able to deal with it, but rarely tinnitus can be something that's sort of severely intrusive and impacts people's quality of life in a major way, and can be associated with anxiety and depression and even possibly suicide risk. So these are sort of definitely the cases from my perspective as a treating doctor that are important to identify from sort of a mental health perspective and make sure they get the appropriate treatment from that perspective. But thankfully, as I said, that's pretty rare. Vast majority of cases are much more mild. So tinnitus itself is not considered a disease. It's not in and of itself something that's dangerous or a sign of anything more serious going on vast majority of the time. Another common question that I get asked is tinnitus causing me to lose my hearing? That is definite no to that question. And it's more of a, we'll get into this in a little bit too, but it's more of the reverse, actually. It's more of a, can be a reaction to a hearing loss that already exists. But it's not in and of itself a disease or a problem. It's more of a just reaction that's bothersome. So it's a symptom that has many possible underlying causes and contributing factors. So what exactly is it that causes tinnitus? So basically, the definite answer on this is not known yet. There's still a lot known about it, but what we think is that it's something similar to a phantom limb phenomenon. So if you've heard of this, this is the phenomenon where amputees that are missing a limb can still have a sensation of pain or sensation of as if the limb still exists. The idea with tinnitus is that it's something similar to this, where it's a reorganization of auditory pathways in the brain, most commonly being in the context of a hearing loss, where the brain is sort of missing out on inputs that it used to get from these little nerve cell fibers coming from the inner ear. It reorganizes itself and you begin to hear a sound. That's kind of one pathway, but there's also many people who have tinnitus and don't have hearing loss. So it's clearly there's likely other factors at play as well, but that's kind of the predominant theory on what actually causes it, is that regardless of what the underlying issue is, it's some sort of abnormal brain firing pathway. So what actually causes it? And this is by no means an exhaustive list. There are many other things that you could add, but this is sort of the list of the most common things. So by far and away, the most common cause is that, as I said, it's a reaction of the brain to an underlying hearing loss or hearing change. So most common cause of hearing loss in general would just be run-of-the-mill age-related hearing loss. As we age, nerve cell fibers sort of degrade and brain isn't getting inputs it used to get. Even something as simple as earwax, if it's obstructive enough, blocking the ear canal, could cause a mild hearing loss and could cause tinnitus. Fluid in the ears, ear bone problems, inner ear disorders, even eustachian tube problems in the context of allergies, for example, causing clogging in the ear, and that can cause tinnitus. On a similar note, noise exposure history has a strong association with tinnitus. So this would be occupational exposure in the past, military history, a lot of loud noise exposure, but that's tied in with hearing loss as well, because the noise exposure tends to cause a hearing loss, which then would in turn cause tinnitus. Certain medications, specifically certain types of chemotherapy, very high dose aspirin, not a regular baby aspirin, but like a 325 milligram daily dose of aspirin. And certain diuretics can cause direct injury to the inner ear. There are numerous medications where tinnitus is listed as a possible side effect, but these ones that are listed are really the only types of medications with known adverse effect on the inner ear. Otherwise, basically, like almost any medication, if you look at the list of side effects, has tinnitus listed as a possible side effect. But in my opinion, it's just that tinnitus is so common in general, and many people are on various medications, and is there a sort of random timing that occurred where you started a new medication and then you began noticing tinnitus? But if it's anything outside of these sort of medications that I listed, then it's very unlikely that the medication itself directly caused the tinnitus to start. Vascular abnormalities. So this is rare. This is more specifically when it's a tinnitus that's described as with a pulsating quality. So more like you hear your heartbeat in your ear. There are some basically abnormally formed blood vessels that can be nearby your ear with abnormal blood flowing by your ear that you could hear as pulsating. So that's pretty rare. Concussion, head injury is definitely an association. TMJ problems is common. The thought here being that the jaw joint itself basically is very close in proximity and anatomically to the ear, kind of shares a wall with the ear canal. So anything that's just causing strain, muscle tension, that's nearby the ear, the brain can perceive as a problem with the ear, and that can be enough to trigger some tinnitus. Sort of along the same lines, any neck or shoulder musculoskeletal problems can be something that triggers it. Same idea, it's just the brain doesn't know the difference between a muscle strained nearby the ear because of an external problem versus an actual ear problem. But regardless, it's sort of brain senses something is going on, and that's why you start to hear a sound. Sometimes just anxiety, stress can be a cause. And this definitely seems to be something that it causes a lot of fluctuation in tinnitus. So when we're tired, not sleeping well, muscle tension levels are higher, stress levels are higher, tinnitus definitely tends to be louder. And then sometimes it's just unknown. So we might try and go through a usual list of all the common, uncommon things that can contribute. There's not a specific cause we can pinpoint, and people still have tinnitus. So sometimes it's unknown. So what is the workup? If you were to come to see me in the office, what would we be doing? So we'd be doing a lot of talking about what it is that you experience, what are the modifying factors, how bothersome is it to you, what's your medical history, medications you're on, what may be changed if this is something that started recently. But other than that, most importantly, medically, the first thing to check is a formal evaluation of your hearing, which would be the first step with a full audiogram, because as I mentioned before, one of the most common things to cause tinnitus is that it can be a sign of an underlying hearing loss or hearing problem. So even if you haven't subjectively noticed any problem with your hearing, that would still be the first thing we check. And sometimes we will find out that there is a mild hearing loss going on that is likely the source of what is causing your tinnitus. Which sometimes may point us in the direction of an other underlying diagnosis that may be able to be treated otherwise. So that's typically the first step, and kind of the most important step medically is to evaluate what, if anything, is going on with your hearing. Sometimes we would do imaging to look at the inner ear sort of structurally, also to check if there's any possibility of these vascular problems nearby to the ear that I was mentioning. This is pretty rare. Usually the only time we do imaging is if it's truly a unilateral or exclusively one-sided symptoms, maybe a little bit more suspicious of an inner ear problem. or as I said before, if it's really pulsating and sounding like your heartbeat in your ear, we may use imaging to check for if there's any vascular problem going on. But that's pretty on the rare side, and the odds of finding something, even if we do some sort of imaging test, is typically pretty low. So the most common question I get is, will this go away? Which the answer is, unfortunately, that it's very unpredictable. There's no way to know what's going to happen in the future. One thing I know we can tell you for sure is that it almost always is very sort of fluctuating. It can come and go. It can be more or less severe. Days, weeks at a time, can be very severe and bothersome. Then maybe it goes away for a few months and then comes back. That's very common. Also, just within the course of a day, it tends to fluctuate. Most people tend to notice it more when it's more of a quiet environment and less things going on, so less other distractions for your brain. So a lot of people are bothered by it at nighttime, trying to go to sleep. It's totally quiet. There's sort of nothing else going on in your brain. It tends to be really loud at that point. So that is something we can almost guarantee, is that it will fluctuate. There is always some chance that it may be something that goes away. It's hard to give specific numbers or factors that play into this, but in my mind, the shorter it's been there, the odds of it going away are higher. In one study, 50% of patients with tinnitus noted some improvement over a 5-year period, whether it became less severe or went away entirely. So in general, kind of a cutoff is like, if it's been there for less than 6 months, there's still a good chance that it may either become less severe or go away. If it's been 1 or 2 years and it's constant, then the odds of it going away at that point are pretty low. But really the focus in terms of managing tinnitus should not be on when or if it will go away, but sort of learning the tools that are available to learn how to deal with it, how to manage it, because it is something that, even if it does go away, can always come back. So if you can sort of arm yourself with learning how to deal with it, that's the best strategy. So what is available as far as treatment? So at this time, there is no specific treatment or cure as far as the sound itself. As I said, it's really more about learning how to manage your reaction to it and suppress the perception of the sound. So it's kind of this vicious cycle where the sound is there. The more you focus on it, the more you get stressed and anxious about it, the louder it gets. And it's like a self-perpetuating vicious cycle. So the treatment for it is sort of to try and do the opposite of that. Try not to pay attention to it. Try to just ignore it as much as you can. And eventually the goal is to have something called habituation, which means your brain sort of doesn't pay attention to it anymore. Even if it's there, if you can have it be less and less of a problem, something that affects you. So what is helpful in terms of treatment? One is just general healthy lifestyle is always a good idea. Getting good sleep, minimizing stress, which we all would like to do, is obviously not the most helpful advice. Staying away from alcohol and caffeine is helpful. Sound therapy. So basically, this is what we refer to as masking. So what I was kind of referring to before is having some other noise to distract your brain from the tinnitus itself. So whether this is something as simple as leaving a fan, TV, or radio on, particularly at night or anytime it's quiet when it would be really bothersome to you, you can look into an actual white noise machine. There's a lot of options out there. There's pillows, there's tinnitus pillows that play white noise that you can sleep with. There's many smartphone apps specifically for tinnitus that you can sort of play around with different types of white noise. There's something called pitch matching. You can try and play a white noise that matches the pitch of the tinnitus you hear to try and basically cancel it out. But basically the idea of all of these things is to really just distract your brain from the actual tinnitus that you hear by using a competing sound, with the idea being that not necessarily that you have to do this forever, but if you can get your brain to not focus on the tinnitus sound, over time, it hopefully will become less and less something that bothers you and something that you need to deal with. There are also sound generators that are similar to hearing aids. So without the actual function of a hearing aid, just something that looks and sort of functions like a hearing aid, but all it does is play a sound into your ears with the same idea. So if there is an underlying hearing loss that we identify as part of the workup, hearing aids can be very helpful, even if the hearing loss itself is something that's very mild and you haven't noticed a subjective problem hearing, and you would never have considered a hearing aid for the purposes of hearing alone. And I would not recommend you necessarily to get a hearing aid just for the hearing purposes. But even if it's a mild hearing loss and it's enough that sort of your brain is noticing something is going on there with your hearing, a hearing aid can be really helpful to quiet down tinnitus. So if I have patients that have bothersome tinnitus and all these sort of conservative things we mentioned so far are not helping, I always recommend to try hearing aids. Sometimes people will notice a sort of dramatic benefit just from the moment you put the hearing aids in, which is the idea is going back to that sort of brain reorganization theory, that giving this input back to the brain that it's been sort of missing out on, hasn't been getting, can help quiet down that sound. So that's sort of something you would work with the audiologist on, get a feel for what it's like to wear hearing aids. And there are definitely many people out there who wear hearing aids exclusively because of tinnitus and not because of a major hearing problem. Other things, so addressing any of these other factors that might be playing a role. If you have TMJ, getting that addressed. So working with a dentist or oral surgeon. If you're grinding your teeth at night, wearing a night guard can be helpful. TMJ is a big one. I see this a lot. So there's a lot of treatments out there for TMJ itself. Botox is something that can be helpful to sort of chemically relax the muscles that are the problem in TMJ that are sort of overactive. All the muscles around the jaw joint are just tense, strained, inflamed. So that's what you would work on as far as TMJ. And then neck and shoulder problems. So sometimes physical therapy can be helpful. Again, it seems like for whatever reason, a big component is just muscle tension and muscle strain. So doing whatever you can to minimize that is helpful. And then finally, so there's something called tinnitus retraining therapy. and related to cognitive behavioral therapy, which are also treatment options that have evidence that are helpful for tinnitus, which is basically, so the tinnitus retraining therapy would be something you would do with an audiologist, usually at like a specialized center for tinnitus. And it would be kind of purposefully exposing you to the sound, using some sound therapy, but it's really more of a cognitive therapy with sort of strategies to ultimately try and get you to be able to just cope with and deal with the tinnitus and not have it be something that causes you a problem. But there are evidence for both of those types of therapy as an option as well. So there are many things out there that you will see advertised as treatments for tinnitus, but unfortunately, most of these really are not supported by the medical literature. So like if you walk into any drugstore, you will find some supplements saying cure for ringing in the ears. There's really no evidence for any of these. Specifically, so there's definitely an association between patients who have bothersome tinnitus and depression and anxiety, but there's no specific evidence that using medications for depression or anxiety treat the tinnitus itself. So while it may help if there's a known history, ongoing depression or anxiety that needs to be treated otherwise, it may help sort of lessen the severity of the tinnitus, but as a treatment for tinnitus itself, those medications, there's no evidence that is effective. There's many supplements, as I mentioned, that are going to be, you're going to see labeled as tinnitus treatment, but have no evidence that they do anything. And these things have actually been studied, and the outcome has been that they do not work. So I would not recommend taking any of these supplements, even though you may see those in the drugstore, again, labeled as the cure for tinnitus. And that's a list of some of those that have been studied. One final thing that is mentioned a lot, but it's just unknown at this point, as far as medical literature, is acupuncture. Anecdotally, I have definitely had patients report to me that they have found some relief with use of acupuncture, but there is just not enough data or information available yet to say as a medical community if it can really work or not. But generally, unlike the supplements, which there can be a lot of side effects from supplements, acupuncture is something that's pretty low risk. So if it's kind of like 50-50 unknown if it's really going to do anything, but low risk, that to me is something that's worth trying. And as I said, anecdotally, I have had many people tell me that they have done acupuncture with some good success. So overall, summarizing points in general, tinnitus there's a lot still unknown about it. It's an area in medicine where a lot more research is needed. But takeaway points are tinnitus itself is not dangerous. It's not a disease. It's not causing you any harm. It's not causing you to lose your hearing. It's more just something that whatever is causing it, it's just a kind of maladaptive reaction of the brain. And it can be really bothersome and really annoying and hard to deal with, but it in and of itself is not something that's dangerous. There is no quick fix for it, but there are a lot of things out there to explore, and just know that it is possible that you can deal with it and It does not have to impact your life in a negative way, is my summary. So I guess now that was only 35 minutes, but I guess we will proceed to answer some of these questions. And then this is just my contact information.
Yeah, we do have a number of questions. So our first question, if the tinnitus is a particular sound such as hissing, does it ever change to a different type of sound?
Yes, it definitely can change. That is very common, and you can have more of like, I actually saw a patient today or yesterday who has been having sort of like humming sound in both ears for years that she's used to dealing with, and then recently had like a very loud high-pitched ringing in one ear that was coming and going. Basically what I did for her was recheck her hearing. There hasn't been any change, but she does have known hearing loss in both ears, which is likely contributing to the symptoms in her case. But it commonly can change, and sometimes we may not have a good explanation for that.
Okay. Does tinnitus happen immediately after one of the causes, or can it be a delayed reaction, such as a sudden loud noise, working in a loud environment, etc.?
So it can definitely be delayed, especially in the case of a loud noise exposure, because that can be cumulative. So if you're working in a factory with loud noises, and sort of the cumulative exposure is going to gradually cause some damage to the nerve cells of hearing in your ear. It's not always the case. Like, there are many people out there that have a lot of loud noise exposure and still have normal hearing. But it just seems like it's another thing we don't have all the answers on. Some people are more susceptible or get more damage to their hearing with a even less level of exposure, but that definitely can be cumulative. So you may not have ringing or tinnitus after just like 1 or 2 nights in a loud environment, but cumulatively, gradually over time is sort of causing a little bit of damage, and it can present with tinnitus later on, for sure.
Hey, how does one determine if tinnitus is a hallucination, or when should one get brain imaging?
Hallucination would be something associated more with a psychiatric condition. So if you have no other psychiatric symptoms, then it would be unlikely. But if there are any psychiatric history, psychiatric symptoms like mood changes, for example, then you might want to explore that with more of a psychologist or psychiatrist. As far as that goes, the second part was, when is brain imaging necessary? Basically, it's very rarely necessary. To me, the two sort of times we think about it are if it's really exclusively something happening only on one side. So I hear a ringing in my ear, it's only ever in my left ear, and it's constant and it's been there for months. We may check and look, just make sure there's not anything structural going on in the inner ear that's causing it. But again, usually the imaging ends up being negative. So even probably a lot of the imaging that we order is not entirely necessary. And the other scenario is if there's a concern that it's a vascular problem, which usually presents with what sounds like a pulsation in the ear, heartbeat sound. Those are kind of the only two situations. Otherwise, routinely for workup of tinnitus, imaging is not on the list.
Okay. Would someone see you first before an audiologist?
So in my office, we work together and we have audiologists in my office. And you would typically see both of us in the same day, ideally, and have a hearing test first with the audiologist and then see me afterwards. It's not always possible in just with scheduling wise. But you could go either way. You could see an audiologist first and see what they can come up with. They may recommend you to see an ENT or vice versa. But if you come to see me with any symptoms of tinnitus, I will want a hearing test as part of the workup.
Okay, can high intake of sodium trigger tinnitus?
So it can specifically in one specific inner ear disorder, which I did not include on my slides, but something called Meniere's disease, which is an inner ear disorder that can cause hearing loss, vertigo episodes, tinnitus. So in that specific situation, yes, salt intake can, and the first line treatment for that disorder is to stay on a strict low salt diet. So that's one of the reasons we would have you get a hearing test when we're working up tinnitus, because that disorder presents with a specific pattern of hearing loss that you can only tell on an audiogram. There's a big spectrum of symptoms and things that type of disorder can cause as well. But so in general, no, but in the case of any type of a Meniere's disease picture, then yes, which we can only diagnose one with history, but also with an audiogram.
Okay, we have a couple questions about TMJ. One is, would Botox treatment help with TMJ? And the other is, how would one find out if they have TMJ?
So Botox, yes, I mentioned it can be useful. So TMJ is also something that's very complex. But it seems like sort of a root problem of TMJ itself is that it's just muscle tension that for some people tends to, for whatever reason, end up in all the muscles around the jaw. So Botox chemically inactivates those muscles. So it can be helpful just because instead of all that muscle tension, whether it's TMJ is not always just clenching or grinding your teeth. Sometimes it's just muscle tension. So yes, it can be helpful. How to find out if you have it? I tend to diagnose it a lot just because there's a lot of overlap with symptoms that can be caused, especially like ear symptoms with nothing that I can find wrong with the ear. There's tends to be a lot of overlap with TMJ, so I tend to diagnose it a lot in my practice, but it's also something that a dentist or an oral surgeon would also diagnose. So if you think that may be something that is affecting you, you can start with your dentist. But it's kind of, there's not like a one quick test for it. It's more about what you describe, what you're feeling, examination. I would say in general, probably the first place to start for TMJ would be, you can start with just your regular dentist and see what they think.
Okay, if someone has tinnitus in one ear, will they necessarily get it in the other?
No, not
Okay.
necessarily.
What can I do about, and pardon my pronunciation, hyperacusis related tinnitus?
So yeah, that is a challenging situation for sure. Hyperacusis is a sensitivity to whether it's loud sounds or specific sounds. Really, the most effective therapy that I'm aware of for that is the sort of cognitive behavioral therapy where you work with a therapist on kind of managing your reactions to these stimuli that are bothersome to you. It's not something that there's really any medical cure for otherwise. So it's kind of similar to tinnitus in that the best treatment for it is just to try to learn how to manage it.
Can wearing earplugs at night make things worse or cause tinnitus?
I get this question a lot. Same about like wearing AirPods. So earplugs at night, no, would not expect to cause tinnitus or cause any problem. AirPods also, or any type of in the ear headphone, I am okay with. It's the only time I would not be okay with it is if you're listening to excessively loud music or anything that may cause a noise-induced hearing loss. But otherwise, earplugs, headphones, in and of themselves, not a problem.
Okay, we have a couple questions about eustachian tubes and postnasal drip. So could postnasal drip be a cause? And someone went hiking today, came home with clogged ears, and the tinnitus became severe. So does Sudafed help at all?
So eustachian tube issues can definitely factor in. I would say it's kind of rare for that to be like the exclusive cause of tinnitus, but it can definitely make things worse. If the pressure is off in your ear because the eustachian tube is clogged, could definitely make tinnitus worse. So I would say like an acute episode where it sounds like maybe you hiked and you went to an altitude and now the ear just hasn't been able to adjust. I would say the first thing I would try would be Sudafed for a few days and see if that helps just decongest your eustachian tube, open up the eustachian tube, help it be able to compensate with the pressure in your ear. First thing I would try would be Sudafed. Otherwise, a nasal spray sometimes helps. The same thought process, but really just so the eustachian tube is the tube that drains the ear to the back of the nose. So getting rid of any amount of congestion, inflammation that may be nearby in the back of the nose where that tube drains to can be helpful. I can stop this. So yes, that Sudafed, other thing in nasal spray, and postnasal drip, yes, could be a factor also, because postnasal drip can contribute to eustachian tube issues.
Okay, here's a question about hearing aids. If someone has the tinnitus much louder in one ear and they've learned to live with it, if they get a hearing aid, can you do a hearing aid in just one ear? Someone told them that you always have to wear hearing aids in both.
So it depends on your hearing loss and specifically what your hearing loss is. If you have hearing loss in one ear and tinnitus in one ear, then you would only need to wear a hearing aid in one ear. If you have hearing loss in both ears, then wearing a hearing aid only one ear would probably not be advisable, because the ears really need to work together to sort of time where sound is coming from and the environment. So if you only amplify one ear, you're not going to get as good of an experience with the hearing aids if you have hearing loss in both ears. So that really would depend on what your actual hearing at baseline is. Sometimes if it's asymmetric, if you have just a mild hearing loss in one ear and a severe hearing loss in the other ear, you could get by with it with just a hearing aid in one ear. So not always mandatory to have two hearing aids.
Okay, can tinnitus ever be from a nerve issue in the inner ear, like a cranial nerve that's inflamed?
So the nerve of hearing is a cranial nerve. It can get inflamed at times. There's something called sudden hearing loss, which is where basically this is another one of these things that we don't have all the answers on, something that happens out of the blue, but you can just get a sudden drop in hearing in one ear, which we think happens from inflammation. And you definitely can have a lot of tinnitus in that context as well. So the answer to that question is definitely yes, although that is something, fortunately, that's very rare.
Okay, is tinnitus genetic or inherited?
Um, it can be genetic if there's an underlying genetic hearing loss
Hmm.
that is causing it, but otherwise the tinnitus itself, no, I would not consider it to be genetic. But if it's in the context of a hearing loss that is genetic, then yes.
A couple of people have commented that the tinnitus is affecting their hearing test. So is there anything they can do
So
about that?
a lot of people feel that way when they take a hearing test, that it's sort of hard to distinguish what is coming from the hearing test versus what is your tinnitus. The only thing that I can sort of say is that it's very common to feel that way. But I mean, I see many people who feel that way, and they get hearing test results that are very symmetric and show like the exact same amount and degree and exact same pattern of hearing loss in both ears. So to me, it does not seem like tinnitus truly interferes with our ability to do a hearing test, although it's definitely a common experience of people that it's challenging. But to me, it would be basically impossible to reproduce artificially the exact same result in both ears unless it was a true result. So I don't think that that is a problem. You just do the best you can on the hearing test, and there's always some variability in the hearing test. If you did a hearing test today and tomorrow, it would be a little bit different. But it's not enough variability from the tinnitus itself to really throw off the results. It just seems like it's still reliable.
Um, does your office conduct retraining therapy?
We do not. I wish I knew of better resources for that locally. As of right now, there's a center in Manhattan that I tend to refer people to.
Okay. Okay. If damaged nerve cells in the ears can cause tinnitus, can Q-tips damage the nerve cells and thereby cause tinnitus?
Q-tips cannot, just physically, anatomically, cannot damage nerve of hearing cells. I mean, I suppose anything is possible, but what you can damage with a Q-tip is your eardrum. You can damage your ear canal, and you can damage your ear bones. Those are a lot more accessible than the hearing nerve cells, which are deep inside your ear, encased in bone. So no, you really
Oh.
can't damage that specifically with a Q-tip. But as an ENT doctor, I would definitely not recommend inserting Q-tips into your ears in general because of the other things I mentioned. That I have seen people perforate their eardrums with Q-tips, and that can cause a permanent hole in your eardrum, which can cause a conductive hearing loss, so not a nerve problem, but a hearing loss because you have a hole in your eardrum, which could in turn cause tinnitus. So
Oh,
sort of indirectly, yes, but no.
don't use Q-tips.
Yes.
Okay, so people are wondering, are crickets and clicking sounds considered also tinnitus?
Yes, can be anything. Crickets
Okay.
is definitely a common one. Clicking also.
I mean, the questions are coming in faster than I can keep up. Let's see. I heard it may kill brain cells. Other brain issues I was referring to would be dementia or any cognitive impairment.
So it's not that tinnitus itself damages brain cells. No, it's just a sort of reaction of wiring circuitry in the brain that sort of goes out of whack, but it's not that it causes damage. As far as dementia is concerned, I mean, it's definitely increasing incidence of tinnitus with age, but it's because hearing loss incidence also increases in age, and it's not that the tinnitus causes the hearing loss, it's the reverse. So there is probably some sort of association with dementia and tinnitus just for that reason, but it's definitely not that it causes it.
Okay. If stress is the cause and stress is reduced, will the tinnitus reduce also?
It's never a guarantee, but we can hope. That's kind of all you can do. Is try your best and hope for the best, but it's never a guarantee.
Are there any studies out there?
There are probably hundreds of thousands of ongoing studies all the time. So yes, there's definitely, as I said, a lot of research and answers still needed, a lot ongoing at any given time. And hopefully we will get some more concrete answers on some things.
Earwax. There was, so the best way to clean ears without Q-tips, getting rid of earwax, does that help?
So
Can ear,
go ahead.
I was going to say, can ear stents help?
I'm not familiar with an ear stent.
No, okay.
Not sure what that is. But in general, wax can contribute, but it really has to be a really excessive amount of wax that's sort of completely blocking, occluding your ear canal and causing a hearing loss because of the wax to cause tinnitus. So it can, but only if it's a really excessive amount of wax. So in general, like average person that does not tend to have an excessive wax buildup problem, I would getting rid of wax may not make much or any difference. That I can only tell you by looking in your ears. But in general, as far as how to best way to get rid of wax, so again, no Q-tips, because although you might get some out with the Q-tip, overall it tends to just push the wax in further and make it more of a problem. Over-the-counter drops are helpful. Debrox is one of the brands, also just called wax softening drops. To soften it, it doesn't necessarily get rid of it or make it come out, but if you soften it, sometimes it's more likely to come out on its own, or you can try flushing it out in the shower after you've used the drops for a while to soften things, or sometimes it comes with a little syringe. You can try flushing it out. I would not recommend any of these devices that you see that involves inserting anything into your ear for the same reason as a Q-tip. It's very easy to cause an injury. So if you think you might have a wax problem, you could maybe try some drops. Sometimes peroxide works, just kind of soak your ear with peroxide. And then kind of shake your head against a towel, get some wax out that way. If those things aren't working, I would see a doctor and have them check if you have an excessive amount of wax or not.
Okay, if someone has had hearing loss and they're interested in seeing if hearing aids work, can that be determined during an office visit?
So in our office anyway, that is something yes, that you could explore with our audiologists. Basically, you would be able to do a little trial in the office, and you can bring a family member with you to that appointment and just really get a feel for what it's like to actually wear the hearing aids. So one is, yes, you can do a short trial in the office. The other thing is there's always some amount of a return period on hearing aids, at least with our audiologists. If you get them and you don't feel like they're helping or working, that they do always have some sort of a return period.
Okay. Do you have any studies off the top of your head that you suggest people look into or research?
Uh Nothing specifically. I mean, one resource in general that's helpful is the American Tinnitus Association website. It's just ata.org, I believe. They have a lot of patient specific resources and information that is reliable and can be helpful. So that's where I would direct you if you wanted to do some more research.
Okay, we have a number of questions, and unfortunately, we're out of time. So if we can do two more questions. You stated that caffeine should be avoided. How much of an effect does caffeine have on symptoms? So do you suggest that they cut out their daily 3 to 4 cups of coffee to see if there's an improvement? 3 to 4 cups is a lot of coffee.
Yeah, I mean, it might be something worth trying. That's not something that there's going to be a distinct answer on how much it's going to help, but yeah, I mean, if not cutting out entirely, maybe cutting back from a 3 to 4 to 1 to 2 and see if that makes any difference. And if it's sort of less severe, then that's great. And if it's not completely cured, you could try eliminating. I would sort of do it in a stepwise fashion that way.
And then a couple people commented about having chemotherapy or radiation and tinnitus after that, and just asked you to comment about it.
So radiation in itself is not typically implicated, but there are certain chemotherapy drugs that are classified as being ototoxic, meaning they can cause actual damage to the inner ear nerve cells. So if you think that's a possibility, basically the first step would be to get a hearing test and see if there's any evidence of that. Sometimes if people are actively in the process of getting chemotherapy, that may be something we sort of monitor during their treatment. And if there is a new tinnitus and we get a new hearing test and find that has been a significant change in the hearing, it may be sort of a discussion with your oncologist to see, are there any other alternatives for your cancer regimen that maybe have less of a ototoxic risk. So and sometimes it can be reversible. So if you stop the chemotherapy, it might be reversible.